a psychotherapist at Los Angeles Sex Therapy, and I'm also a clinician that helps support Pineapple Support. And Pineapple Support provides mental health and legal services for people who may not find it otherwise. And I think the reason you came here was to find out what sex positive therapy is. So I'll do my best to break that down for you and let you know why you might be looking for it, how you know you found it, and questions you can ask yourself and your clinician to see if you're a good match. I think the best thing is to start with just a definition of what is sex positive therapy. I went online and I looked up a lot of different definitions, and there are a lot out there. So you can look them all up and see what resonates with you, but for the purpose of this conversation, the one that I think is best is a clinician who can affirm and validate your sexuality without making it the sole purpose of or the sole focus of your therapy. It will definitely overlap within each other, but you may be coming to therapy for grief, or you may be coming to therapy because of financial problems. And if you go and you see a therapist and they're 100% basing all of your problems on the fact that you may be a sex worker or you may be an adult performer, that might not be a good fit. While those may overlap, they're not necessarily one and the same. So another question you might want to ask yourself is, how is it that I even found myself here? Why is it that I'm looking for a therapist? Is it that you've never been to therapy before, but you feel like you need help? Is it you've been to therapy before and you had a really bad experience, and so this is your first time to try it again? Is it, there are a lot of different reasons. Did you move? Was it a financial thing? There are a lot of different reasons that you could be actually looking for another therapist. And those reasons could include isolation. The industry can be super isolating. It could be financial problems. It could be problems within your family. It could be problems within your relationship. You could be being cyber stalked. There could be bad blood between you and someone else within the industry. The reasons are far and wide. There are no wrong or right, bigger or smaller. The issue is that you are looking for help. And so there are certain ways that you can go about looking for help. Pineapple has done a really great job of putting together people that are sex positive, but that doesn't necessarily mean that everybody that they have is a good fit for you. So I just want you to trust your gut. And I know it can be difficult if you've already had bad experiences, especially in the environment we're in, and how culturally what you do might be marginalized or may be judged. So it's difficult to trust people. It's difficult to show up. It's difficult just to make the appointment. But you reach out, you make the appointment, you decide that you're going to go and see this person, and so here you are, you find yourself in front of someone, right? What are ways that you can advocate for yourself? You can ask them anything you want to ask them. I would start with trying to have a phone call instead. It takes a lot of time and energy and effort to actually go somewhere and sit with someone for an hour. Even as a therapist, I don't necessarily need to do that with someone if we're not a good fit. So maybe the first thing you do is ask for a 10-15 minute phone call. Within that phone call, I would highly recommend, before you make the call, have a few questions. And it will be difficult, but say it. I'm a sex worker. I'm an adult performer. I am whatever it is I am. What are your thoughts on that? That might be the very first sign that this is a good match or it's not a good match. And then you just kind of go further and further within that. So a few of the questions you can get together to have, whether it's in person or whether it's on the phone, is, how do you feel about sex workers? Have you ever worked with sex workers before? What do you see sex positivity as? And that may be difficult for you to answer for yourself, so you may want to think about that for yourself before you even ask them. That if you find that you're being judged, or if you feel that they aren't hearing you, or that they are kind of pigeonholing you into a certain place because of what you do, then it's okay to say no. It's okay to get out of there. Your body will tell you if it's correct or not. If you feel that you are in threat, if you are having heightened emotions And not necessarily just uncomfortable. There's a difference between being uncomfortable and feeling threatened. And so it may be a good time, and maybe this is why it would be safe to do on the phone as opposed to in person. It may be a good time to see what it feels like to talk with this person. If it's uncomfortable, if it makes you flush, if it makes you feel a little dysregulated, like feelings you're kind of feeling a little buzzy inside, yeah, that's uncomfortable. Therapy isn't always comfortable. It doesn't have to always be painful. Sometimes it can be, but it doesn't have to be this insurmountable thing that you have to go through. But if you're talking with a therapist and you feel a little uncomfortable, that might be something you can work through. But if you're talking to a therapist and you feel like they don't hear you, they don't see you, that they're judging you, that they're judging what you do, that they are going to automatically say, just put a value judgment on what you do and make everything, orient everything towards that. If that's what you're feeling from that person, then it's okay to say no. And you know, it can be difficult because of what you do. And so a lot of people, they may not look the way you think they look. They might be super generic, vanilla looking to you, but be able to like really show up for you the way a therapist would show up for you. Also, I want to couple with this listening to your body and paying attention to what's going on. I also want to say, give things a chance. You will know if it's right or if it's wrong. And like I said before, just because someone says they're sex positive, just because someone's from Pineapple, doesn't necessarily mean they're your person. Therapists say the wrong things sometimes. Sometimes it really sucks when you, as a client, have to educate a therapist, but also it may just be some little tweak that needs to happen in the room. Because guess what? We're just people, we're showing up the best we can. We might say the wrong things sometimes, but that in and of itself can be therapeutic, to stay in it, for it to be a safe place to work it out together. And that's practice. That's practice for what it might be in the real world. But I will give you that in a therapeutic setting, then there is a lot of safety there that doesn't happen in the outside world, but it can be talked about. And so if your therapist says the wrong thing once, don't necessarily write them off. If there are a lot of red flags adding up, then definitely let them go. But if it's one thing, don't write them off for just the one thing. So now that we've talked a lot about how do you go about finding a therapist, how do you go about checking out a therapist, and maybe you've gone a few times, you've asked enough questions, there've been enough phone calls, whatever it is, you're like, okay, I'm gonna go and I'm gonna sit with this person, I'm gonna do some work to try to feel better about whatever it is that's not going well in my life. So let's talk about what therapy actually is and how you might feel while it's happening. And like I've said before, it's not necessarily always going to feel good. It may feel kind of daunting, but what it really boils down to is showing up authentically and vulnerably, not only with yourself, but in the presence of another person. And when that happens, there may be some times that you leave feeling worse than you came, but you're kind of unpeeling pieces of yourself that have been protecting you. And that protection has been serving you. And there may be some therapists, actually there are a lot of therapists that would say these are maladaptive behaviors. And I really push back on that. I don't like that. I don't think maladaptive behaviors are maladaptive at all. I think they're actually super creative ways to get through whatever it is life has thrown at you that you had to get through. When they become problematic is when you move through life and that's the only way you've known, and now you have a chance to look at those and decide how much of that is still working for you and how much of it isn't. And to have someone to discuss that with and guide you through that from a non-judgmental place is priceless. And so what you'll do at that point when you decide, okay, this is therapy, is you'll start looking at yourself. You'll start looking at why you behave the way you behave, why you react the way you react. And it is hard. It's very difficult because it's all we know. Not only is it all we know, it's what has kept us alive. It's what has gotten us to where we are. But we have choice. We have agency. We get to decide, hey, are we going to continue being that way or are we not? And it is a choice. Some of that may still be serving you. And if so, awesome, great. Beef it up, build it up, honor it, do more of it. And if it's not, figure out a way to slowly start to acknowledge it, thank it, and let it go. Because it was there for a reason. So I feel like I just took you down the rabbit hole of how therapy can be really hard and difficult. But the reason you go down that is to change. And these changes come in little bitty, minuscule bites and pieces. And you'll have moments because of a difficult conversation you had, because of a difficult memory you were willing to face, that you actually start showing up differently. And it'll be something small, but it'll feel really good and you'll have an aha moment. And that will just start to slowly tweak and shift everything. And then you start showing up a little bit differently with people you feel safe with. Then you start showing up a little bit differently with public in general. And then you start showing up differently with people you actually care about and that it's vulnerable to show yourself. And you just slowly kind of start to shed some old things that don't feel so great and take on the new ones. And all of a sudden things start to feel a little bit better. It's not a quick process. It's not always a fun process, but it's really rewarding and it can feel really good. If you have a problem with your therapist, it can be a really great place to test this new you that you're becoming. To say, hey, I want to challenge you. Hey, something didn't feel good. Hey, whatever it is that was problematic for you in your interaction with your therapist, bring it up. Bring it up. Practice there. And if you bring it up and it doesn't feel safe, again, you can say no. You can always leave. But if you're with a good therapist and you've already decided this is someone who sees you and gets you and you're going to let them make mistakes, stay with them. Practice it there. Because if it's happening, if it's showing up in the therapy room, it's more than likely showing up in your life. And so take that. You're paying for this time. You're paying to try these things out, to feel what it feels like to let some things go, to take some other things on. So it's a beautiful place to do it. Try it. One way to look at it is you recreate in the room with your therapist exactly the way you're living your life outside of the room with the therapist. And so there's a lot to be gained there. There's a lot to play with there. And I highly recommend using humor in your therapy. It's collaborative. It can be fun. It can be creative. And it's going to take you to dark, deep places. So why not find moments within that, just like within life, where you can laugh about it, have a good time with it. And I'm not saying that whatever you're dealing with isn't dark and hard and difficult, but there can be moments where you find reprieve from that. You can 100% yell at your therapist if you need to yell at your therapist. It may not be fun for either of you, and that's okay. It's okay. Whatever happens in the room is okay. It's the deconstructing it and figuring out maybe where that came from and how you would choose to maybe interact differently at a different time. But explore it. And you can explore any of it with your therapist. I've just been asked, is my therapist like my friend? That's a tough one. That's a tough one. Your therapist isn't your friend in the sense that there are definitely roles that each of you have chosen to adhere to. And that's good. And that makes it safe. Your therapist probably cares a great deal about you. Your therapist wants to be there for you. Your therapist is probably rooting for you to do well. But you have to remember that you've both agreed to certain confines within that relationship. And that's good and that's healthy. And because of that, you can push things a little bit further. And because that, you can believe that what they're telling you is really from an outsider's perspective. And so there's a lot of enrichment in that. So it's this really beautiful relationship in the sense that you've got someone who cares about you, and you are in a room with someone that you can be vulnerable with, yet you get to play with this thing that we call psychology. You know, you get to like literally like externalize what it is that makes you you, and what that is that makes you interact in the world, and what of that is working and what of that is not working. And that's a really beautiful place to be. So if you can find the right therapist, there's so much great work to be done. So there's a whole idea around corrective emotional experience. And basically what that means is if someone has been hurt, if someone has been traumatized, if someone has been, I don't really like the word damaged, but a lot of people use that. If someone has had something that has really hurt them, then, you know, it's you have one bad experience, it's 100 good experiences is going to barely tip the surface of the negative side of that, right? And so something that you really get to gain by working with a therapist is you get to perfect that corrective emotional experience, because you can say what you need to say, you can work out what you need to work out, and your therapist is there to hold that. That is not to say that your therapist isn't a complete person. That's not to say that your therapist doesn't have their own ideas and their own values and their own life. It just means that you two have decided that the relationship you're going to have is one in which they can hold what you need to bring them. And that's not something to be taken lightly. Bring it, explore it, go there with them. And it's helpful to say, hey, what's that like for you too? I don't know that all therapists feel that way, but I know that personally as a therapist, I want to know that they understand what it's like on this end to hold that, because that is exactly what it's like for the other people in their lives that are holding that. We just get to do it in a safer space. Sex positive therapy doesn't even have to be about sex. It can be. It needs to include anything that you bring to the table that encompasses sex, whether it's your sexuality at home, whether it is your monogamous versus non-monogamous versus poly, all the things. It doesn't really matter if it's about work, if it's personal. What matters is you aren't that one thing. What you are as a person, what you are as a client is all of you, the sum total of you. And so for someone to be sex positive is just going to acknowledge that. They're going to acknowledge that. And they also need to be given the wherewithal to sort of like look at it if it seems to become problematic. That's all that really is. You are a whole person. You are all the things. I hope sexuality is part of that for you. If I'm a sex positive therapist and you happen to be a sex worker, you happen to have been brought to me through Pineapple, and you show up and you need to talk about something, whether it is grief from the loss of a parent, whether it's a bad relationship with the person you're co-parenting with. We only need to deal with what you need to deal with. It doesn't have to be based in your job. It doesn't have to be based in your sexuality. We need to deal with what you need to deal with. If those things overlap, great. We'll touch on that. But that's not where it has to go. So if you go to someone and you have a very specific issue you need to deal with, and they are constantly trying to loop it back around to your profession, you might want to question that. And that may be enough. It doesn't necessarily mean they're a bad therapist. Just questioning it alone may be all it takes. Question them. Have a conversation. If after that conversation you feel satisfied and they've let it go because it really isn't the issue, then great. So don't automatically write them off because they asked about it. You write them off if they keep going there and you're not getting to deal with what you need to deal with, and you're not getting the help that you need. To sum all this up, all in all, if you need help, ask for it. get it. And if you're going to ask for help and you're going to look for it, just be sure you know these key points. You have the say. You get to say yes, you get to say no. You choose your therapist. You can ask your therapist, what do they think about sex positivity? If you get in the room with them and they're saying things you don't like, you can question them, you can stop them, you can advocate for yourself. You need help, you get help. If you see that you're not getting the help that you need, you can move on. And once you're in therapy, just realize there are going to be uncomfortable moments. There are also going to be moments that feel really great. And don't be afraid to stick with them. Appreciate that. Appreciate the relationship you have with your therapist. Practice in the room. Say whatever you need to say. And it can be scary, but it can be really amazing. So stick with it. I hope you found this helpful, and whether it's through Pineapple or whether it's through Los Angeles Sex Therapy, I truly hope you find the help you're looking for. There are a lot of good therapists out there. Hang in there until you find one.